Hello, my name is Matt Hanks and I'm an equine vet at Central Equine Vet Services in Edinburgh. And I'd like to welcome you to the Central Equine Vet's question and answer session. Today, we're going to be discussing and answering your questions about laminitis. Laminitis is a serious condition which affects horses' hooves. Laminitis causes the feet to become very painful and the horse will find it hard to move around and may spend long periods of time lying down. Now, laminitis can lead to permanent hoof damage and if severe enough can even lead to loss of the horse. But before we understand laminitis, let's review parts of the horse's feet. Now, most of these structures you're going to see every single day. On the outside of the hoof there is the hoof wall, and at the top of the hoof wall there's the coronary band, which is like the quick of your fingernail. And the hoof wall grows down from the coronary band down to ground level, and then your farrier comes along and trims the excess away. Now, underneath the foot you have got the sole, and in the center you've got the triangular frog. Now, inside the hoof there is the pedal bone, sometimes known as the coffin bone, and a tight system of laminae that bind the hoof wall to the pedal bone. Now, the important part to remember is that the hoof wall grows down from the coronary band. It slides down these lamina as they're attached to the pedal bone. Now, horses are effectively suspended by their lamina. And let's face it, they are a very heavy animal. So this is a very energy-rich process. Now, the energy comes from glucose and oxygen, and both these things are delivered to the foot by the blood. So to have a healthy foot, the foot needs blood, glucose and oxygen. Now, to get the glucose into the cell where it can be converted to energy, insulin is required. Glucose can't enter cells without insulin. Now, if your horse has got a condition that makes the insulin not work properly, such as obesity or a condition like Cushing's disease, which is properly known as pars pituitary intermediate dysfunction, or PPID. If your horse has got one of these conditions, the insulin doesn't work properly, and so the cells start to be starved of energy, and then they slowly start to let go of their attachments to the lamina. Now, they don't actually just let go. What happens is that their attachments become weakened, and as the horse is actually standing in these hooves, these attachments can tear away and cause damage and bleeding. And as you can imagine, this is a very painful process. What can also happen is that when these attachments have let go, the tendons at the back of the leg, which are always under tension when the horse is standing, can actually pull the pedal bone round, causing rotation. And what can also happen in extreme circumstances is that the horse can actually sink down in its hooves and the pedal bone can actually come through the bottom of the foot, which, as you can imagine, is a very, very, very painful process. But even if that doesn't happen and the horse survives, and a lot of horses that have had laminitis do survive, these attachment tearers can lead to scarring. Now, as the hoof grows down, once it comes across these scars, the hoof can actually bunch up. Now, the sides don't get affected as badly as the front of the hoof, so the hoof wall continues to slide down normally on the sides, but at the front it can't. So what you end up with is this classic slipper foot appearance of a horse that has had chronic laminitis. And some horses that have had laminitis in the past may never have normal feet again. Now, lastly, whenever we are presented with a horse that has got laminitis, the first thing we do is try and control the pain as best we can, but we also endeavour to determine why the horse has got laminitis. Around 80 to 90% of cases of laminitis in horses is caused by an endocrine disorder, be it obesity or, as I've mentioned, Cushing's disease, also known as PPID. So it's vital that the vet tries to establish what is causing the laminitis, because if we don't treat the underlying cause, then there is little hope of controlling this horse's laminitis. So once we have determined what the cause is, we can dispense medication or we can recommend feeding programs which can try and bring the horse back to normality. Anyway, enough about this. Let's answer your questions. So the first question comes from Janice McCaw, and she says, once ponies have been confirmed with insulin dysregulation, which is also known as EMS or equine metabolic syndrome, can it be reversed by losing a lot of weight like humans? Well, Janice, it can. So if your horse is overweight and what's happened is that the insulin isn't working properly, by losing weight and getting your horse back to a normal weight, the insulin will start to work properly and the cells will be able to take on board the glucose, convert it to energy, and then maintain a healthy attachment in the horse's hooves. So never letting your horse get overweight is vitally important. The next question comes from Gemma Seller, who has a question about Cushing's disease or PPID. So just a little bit of background. So Cushing's disease, or PPID as it is properly known, is an endocrine disorder which affects the pituitary in the brain. And what happens is that the control of the hormones that are released from the pituitary is affected, and too many hormones are released. Now, some of these are pretty much harmless, but some of them affect the way that sugar is metabolized in the body. So what we do is we give them a little piece of medication called pergolide, and that tries to control the hormones that are released from the pituitary gland. So Gemma's question is, the reason that she's asking is that her horse that was on Presend recently had colic. Is there any link between giving your horse Presend and having your horse colic? Well, Presend is a pretty powerful medication. There are lots of hormones that need to be controlled from the pituitary, and colic is a recognized side effect, although we have to say that it is extremely rare. Right, and our last question is actually from Anonymous actually. My horse was diagnosed with PPID, Cushing's, using a blood test. Will the Presend that he's on cure his PPID? Well, Cushing's disease is, for all intents and purposes, incurable. It's a condition which gets worse with age, so older ponies, especially around sort of, I think the average, or the mean age for getting Cushing's in ponies is 19 years old, but it can be as young as 10. So ponies are really, the most common group that will get Cushing's. They'll probably have to be on that medication for the rest of their lives. And what we normally do is we diagnose the condition either with a simple blood test, just walking up and taking a blood, or what we can do, which is slightly more accurate, is we can do what's known as a stimulation test, where we take a blood, give them a hormone, okay, which is completely harmless, wait 10 minutes and then take another blood sample, and the change in the levels of a certain hormone that we measure will suggest whether or not that horse has got Cushing's. Now, once we put the horse or the pony onto the Presend, we will probably wait about a month, 6 weeks, go back, retest the pony to see if the levels have come back down to normal again. And then after that, we'll probably recommend every 6 months just going out, doing a test, just making sure that the levels of the hormone that we test for haven't increased, which they can do even though they're on Presend. Because if you keep the levels under control and your horse is not overweight, as I've mentioned, your horse will not get laminitis. Okay, so there we go. There's our first question and answer session. I hope you enjoyed it. If you've got any questions about Cushing's, obesity or laminitis, just give us a call at the practice. Always happy to talk to anybody about laminitis and how to prevent it. It's a really important disease. And if you've got any other thoughts as to what other topics you'd like us to discuss and answer your questions on, drop us a line in the email or go to our Facebook page and let us know there. So in the meantime, enjoy your summer and enjoy your horses. Take care, bye-bye.